Respected dignitaries, delegates, and volunteers, a very good evening to you all. It's an honor. It's an honor to have you all here, and we hope you're all well and healthy, enjoying the virtual experience on Osmocon's platform. Today's webinar holds the answers to many of our questions, um, like what are the different career options we have after MBBS, and how do we find what's the best for us, what's the deal with next. I'd like to, and how we'll go to abroad. So how do I even begin to make sense of all these options and make an informed choice? The SMLE lab, we have so many exams like MRCS and ANC. Synapse is an online research headed by Dr. Seran Reddy, anesthesiologist, PGIMR Chandigarh. He's a very passionate teacher and has created a workbook-based approach to PG preparation. So it's an absolute honor to have you all here with us today. And we're all looking forward to learning from you, sir.
Thank you, Doctor. Thanks a lot for the kind introduction. Good evening, everyone. And first of all, hearty congratulations to the team Osmicon for successfully conducting the 11th edition of Osmicon. And also a very good evening to everyone and welcome to the session. Today I'll be talking about 4 subtopics. One is career options of MBBS, the need versus the national exit examination next, and INSET, which are the changes which are happening and how can you prepare the best. And when you look abroad, what are the MRCP or EPLAB, USMLE, AMC, Australian Medical Council examinations, and the timelines, how you can go ahead. And what is the importance of portfolio and how you can build effectively when you are looking for a abroad career. These are the 4 things we'll be looking at. And once again, thanks Osmicon team for inviting me. Osmicon has a special place for me. The reason is, in the Osmicon 2021, the first edition of Osmicon 2021, Osmicon 2010, if you can see here, I sent one case report, one paper presentation, and also a poster presentation. And I won all the 3 prizes then in the poster category, case report category, and paper presentation. Then, so Osmicon was the first undergraduate medical research conference in the state during then. And 10 years down the line, coming onto the same platform and giving a talk, I feel it's an honor to me. And I feel this session is going to be very useful, and you're free to ask the questions at the end through a link which will be provided to you. Every question will be answered in the subsequent sessions. Okay. If you see, after MBBS, the first we'll be discussing about the career options after MBBS, and the need and next combinedly we will discuss. If it's a conventional approach, like after MBBS, what majority of the students do, they'll go for post-graduation, whether it be MDRMS or DNB, or if someone this is about Indian PGs. And if someone wants to go to abroad, the options open up USA, to which they go to through USMLE, for UK through PLAB or membership examinations, for Australia through Australian Medical Council examination, and we'll explain in detail, and also through Canada. If someone wants to go in private sector, it can be through corporate hospitals, or they can establish their own clinic. And again, government sector jobs, they can join PHCs as the duty doctors, and defense sector, it may be Army, Navy, or Air Force, and combined medical services like UPSC. This is a conventional approach. If you see, this is directly taken from NMC website. The total number of MBBS seats as of today is 83,200. And at the same time, if you consider all MD, MS, diploma, clinical, non-clinical, government, private, including everything, the number of postgraduate seats is 38,318. And the number of people who attempted the NEET PG examination this year is 1.66 lakhs. Among them, after filling out 38,000, next year again it will be adding up, and this keeps piling up. Next year for the NEET examination, which is going to be the last NEET examination in 2022, expecting 1.85 to 1.9 lakhs, close to 2 lakh people will be attempting the examination. And simultaneously, if you see all DMMCH, this is all including the central institutions, everything, If you see, the total number of seats are 4,421 seats. There's been a lot of discrepancy if you see from 83,200 to 38,000 and 4,400. There's a gross discrepancy, and the supply and demand ratio is not adequate, and a lot of many students keep preparing, and this keeps the competition keeps on increasing. If you see, in 2022 is going to be the NEET examination, NEET PG, and then INSET examination will happen twice a year. And if you come to 2023, it is going to be the next PG and INSET, Institute of National Importance Common Entrance Test. These are the things which are going to be there. And everyone is worried about like what's going to happen with the when the exam pattern is changed from NEET examination to next examination pattern. If you see, as we know, this is going to be held from 2023, the first half of 2023. This is directly from the gadget. It's going to be 2023. The first half of 2023 is going to be there, and mock run is going to be planned in 2022. And they clearly mentioned the results of next step 1 and step 2 be used for the qualifying the final MBBS examination, to get license to practice the modern medicine in India, and for merit-based allocation of PG seats in broad specialties. And how it is going to happen, there's no clear-cut guidelines, but based on the few speculations and whatever the information we are able to gather, it is purely based on the we all know it is going to be based on competency-based medical education. Those who started from 2017, they'll be already had a taste of competency-based medical education. And if you see the topics and outcomes in preclinical, paraclinical subject, medicine and allied subjects, surgery and allied subjects, actually, to be very frank, there's nothing to be much to be worried about the next examination per se. The reason is there's been a clear cut, the number of topics which has to be concentrated, and what are the outcomes, what are you expected to learn. If you master that, it's not only useful for your final examinations, and also you will gain the knowledge, but also for your next examination, both part 1 and part 2. Rather than, if you see, for the NEET per se, there are approximately 85,000 topics where for all the 19 subjects cumulatively. But again, 75 to 80% of the questions do come from 2,500 topics. That is how I'll show you an example of how you can do the smart work. So again, if you see the number of topics cumulatively, they come approximately to 400. And again, the number of outcomes expected from any medical student by the time they attempt the next examination is approximately combining this preclinical, paraclinical, and medicine and surgical allied specialties, it's closely around 3,000 or 2,900. This is what you have to master. So nothing to be very apprehensive. And as you know, the pattern has been changed. Even the MBBS curriculum, phase 1, it is 13 months with 1 month foundation course. But second year, it is 11 months, which is from 18 months, it decreased to 11, and here from 12 to 13 months. And here, the forensic medicine, which was in second year, has been shifted to part 1, final part 1. And in addition to this, if you see, they clearly mentioned next national exit test, MCQ-based theory examination, 1 year compulsory rotatory internship, and probably national exit test 2 is going to be the practical examination. What is the next PG probable scheme of the examination? It is speculated that it will happen for three days, total of 540 marks. And day 1, it will be 180, day 2, 180, day 3, 180. And day 1, medicine and its allied specialties like dermatology and psychiatry, which constitutes 120. And pediatrics will be for 60. And surgery and its allied specialties, orthopedics, anesthesia, carried 120, ENT for approximately 60. Obstetrics and gynecology, along with the radiology, will be approximately 120, and ophthalmology for 60. This is how it is speculated. And among these 540 MCQs, 10% of MCQs from each stream will be from the basic applied sciences, like applied anatomy, applied physiology, applied biochemistry, where they can link up the questions. Suppose a question from anesthesia can be taken up from the respiratory physiology and can be asked, combining those things. And 10% of the MCQs will be from preventive and SPM. And among the total of 540 MCQs, expecting 60% of the questions will be based on the problem solving, and 30% of the questions by comprehension and analysis, and 10% by pure recall based. This is what the next PG probable scheme of the examination. And And if you see the next examination pattern, what happens? And again, we'll get a lot of clarity once they release the guidelines, but what is expected, like based upon whatever the information available in the website, like what we can see that if the next examination or after attempting, if someone passed the examination and their score is very high, they'll be allowed to do the internship and will get a PG seat after they pass the next two examination. And if they pass the examination without not a very good score, but a decent score, will be allowed to do the internship and might get a PG seat. Otherwise, they need to take the examination again. And if someone fails the next one examination, they are not allowed to do internship and can't apply for a PG seat, and they have to wait for one more year to take the next one exam again. Then what happens to next two? Who pass that will get MBBS degree and also license to practice in medicine in India, and also they move to post-graduation after MBBS. What happens if they fail? Again, now they have to wait for next two examination after 1 year of waiting, and they have to get the rank. In a simplified format, MBBS final year, you attempt the next one, you pass, go into the internship, and you attempt next two, you pass, good scores, go into the post-graduation. After next one, if you fail, again, you will stop at the MBBS final year level and again attempt next one after 1 year. And you clear next one and you stepped into the internship, but you didn't get a good score or a decent. If you fail in this examination, you don't get a license. And if you clear this examination, you get a license, but your scores are not so good, again, you may have to wait for 1 more year to get into the post-graduation. This is there's all the speculations, and there's no clear cut. This is going to be the tentatively the plan will be there, and once we get the official guidelines, we'll have a lot of clarity on this. Then coming to INSET examinations, Institute of National Importance Combined Entrance Test, which was started in last year, that is November 2020, the first examination which happened. It includes all the Institute of Medical Sciences, PGMER Chandigarh, and NIMHANS, JIPMER, and Sri Chitra. And when I mention AIMS, it includes AIMS New Delhi, AIMS Bhopal, Bhubaneswar, Jodhpur, Nagpur, Patna, Raipur, Rishikesh. And on average, all these the Institute of National Importance combinedly for a January session, if you see approximately 870, 850 seats will be there. And if it comes to the July session, there are approximately 1200 seats will be there. So approximately in a year, you'll be competing for 2000 seats, 850 and 1200. This is going to be INSET. And the examination pattern is a 3 hours examination. The number of questions is 200 and objective type questions, and incorrect answer carries 1/3 negative marking. And whatever may be the format of examination, let it be coming to the ways of preparation. If you see, let it be NEET examination, next examination, or INSET examination, the fundamentals remain the same, and the medicine remains the same. What you're going to read from the 19 subjects remains the same, but how you're going to apply that knowledge is going to slightly vary. With the same sugar, you can make a juice with, and you can make a sugary cream, and you can make a sweet out of it. All these things, the ingredients remain the same. So how you utilize that is going to matter. And for anything, if you ask me what are the keys of success, among the 6 things I mentioned: smart work, learning from mistakes, coming out of the comfort zone, and doing spaced repetition, regular practice, and time-bound reading. If you ask me to pick it 2 important things from this, I'll say this: learning from mistakes and spaced repetition. Because why is it learning from mistakes? What exactly learning from mistakes is? You might be attempting daily few MCQs, and you might be attempting grand tests. And once you make a mistake in that particular topic, again, you have to make sure that you won't make a mistake from that particular topic in your final examination or any further examinations. A mistake once happened is a mistake, and a mistake which is happening twice or thrice is no more a mistake, and it's a choice. So if you keep learning from the mistakes, let it be a small class test which is conducted on the day of the class, or it might be in the evening leaderboard, or it might be the grand test. If you keep accumulating the number of mistakes which have been done, and you keep learning those from those things, no way you will be mastering around 1,000 to 2,000 topics, and this is where like predominantly your questions used to come. And learning from mistakes is one of the most important things and underestimated thing. And if you see, if you go closely ask, and if you might have seen the interviews of toppers, learning from mistakes is one most important thing. And spaced repetition. when I say spaced repetition, it's a revision with a spaced repetition. We have the tendency to forget in a regular intervals. So striking them at a regular intervals, like 1, 3, 7, 16, 35 days, regularly spending time and time-bound reading. Time-bound reading and spaced repetition, if you combine, it can do miracles. Suppose take, for example, brachial plexus, and if it's been asked for you, like to prepare for brachial plexus, you can take entire 1 day for brachial plexus. You can complete the same thing in 2 hours. If someone says, just imagine, like you are stepping into the examination hall and someone says there are 2 questions from brachial plexus and they give you 5 pages, and if you have only 20 minutes to master the brachial plexus or to revise it, what will you do? You will say like I don't have time, like I won't do that, or you will concentrate for the 20 minutes and try to accumulate the most among the 20 minutes. So please try to do that time-bound reading, where what exactly you have to do is for every topic, keep a time. Okay, and in those particular time, you have to keep say yourself that if I'm going to complete in this particular amount of time, I'm going to learn from this. Else, I'm going to leave this topic. If the time-bound reading, if it's there, it helps you to plan your day appropriately, and the discipline comes from there. And most importantly, practice as many multiple choice questions you come. You may gain a lot of information by reading, but unless until you practice, you don't know how to apply the knowledge which you have gained. So keep practicing the number of questions, number of MCQs, and whatever questions from the you have practiced, what are the mistakes have been done, learn from the mistakes. And always remember, you have to come out of the comfort zone. Miracles do happen only out of comfort zone. When I say comfort zone, I don't want to say like you leave everything, but still you have to confine yourself to use a mobile for a particular amount of time, and distractions for a particular amount of time. So you have to come out of the comfort zone for the amount of time which you have been targeting, so that you can turn your dreams into reality. And when I say smart work, what exactly is smart work? It's not about, you might be reading out of the, as I said, like among the 85,000 topics, there are hardly 2,500 topics from where 75 to 85% of your questions come. Let it be any examination, let it be in the NEET examination, in the future next examination, or it be INSET examination, whatever examination it might be, still there will be hardly 75 to 85% of the questions will be coming only from this 2,500 topics. That's why it's important. If you see, anatomy, you can't go to the examination without reading the pharyngeal arch development here, and in anesthesia you can't go without reading the ASA physical status classification. So this is going to be, there's no, if you say take for anesthesia for example, there will be approximately some around 270 to 280 topics, but among the 36 topics, if you can master, that's it. You will be getting 80% or 85% of the questions. So you should focus or direct your preparation in such a way. First, you have to master these topics, which are very important, and you have to get them on tips. That is very, very, very important. Once you master this 2,500 topics, then you can go to for the rest of the topics, and you can keep mastering. You should not afford to ignore these 2,500 topics, which are very, very, very important cumulatively. This is all about the preparation, where whatever examination it might be, the keys of success still remains the same: doing the smart work, learning from mistakes, coming out of the comfort zone, spaced repetition, and time-bound reading, and practice as many as MCQs as you can. These are the 6 most important principles you have to remember. Let it be any examination, NEET, next INSET, USMLE, PAB, MRCP, AMC, whatever it might be. Okay, and then coming back to the other options. If you see, we know like there are numerous specialties and super specialties. Relatively, what are the new specialties which has been if you see in the last 1 year, last decade, hospital administration, palliative medicine, physical medicine and rehabilitation, transfusion medicine, or otherwise called as lab medicine nowadays. Lab medicine is also another branch. Radiotherapy, nuclear medicine, emergency medicine, sports medicine, aviation medicine, biophysics, family medicine, geriatrics. All these are new specialties, relatively new specialties, and also they have been recognized by the Medical Council of India, I mean the National Medical Council. And if you say this, sports medicine, let's come to the aviation medicine. There are 17 seats every year for aviation medicine, but from Institute of Aerospace Medicine, Indian Air Force in Bangalore. And again, the admission to that is through NEET examination, NEET PG examination. And even for sports medicine, if you see this, there are 6 colleges in the country which are offering sports medicine. Vardhaman Mahavir Medical College, Safdarjung, and B.D. Sharma Institute of Medical Sciences, Rohtak, Armed Forces Medical College, Pune, Regional Institute of Medical Sciences, Imphal, Ramchandra Medical College, Chennai, and Chettinad, Chennai. So all these 6 institutions cumulatively are offering approximately 14 seats of sports medicine from all over India. Again, the entrance is through NEET PG examination. So there are various specialties which we might not be knowing, but through NEET you can enter. And then coming to employment with MBBS, as I discussed, you can with employment with MBBS you can enter into defense services, it would be Army, Navy, or Air Force. Combined medical services through UPSC, and you can join corporate hospitals, or you can establish your own clinic, or you can join PHCs, or you can give the option of industrial medical officer, where by doing a 3 months course of associate fellow of industrial health AFIH, you can work as industrial medical officer. There have been many factories and also many industries where you can work as an industrial medical officer. This is a 3 months course. You have to clear 3 months course, and you have to clear the examination, and you can enter into industrial medical officer. And what are the new horizons other than, okay, I want to explore the new things rather than the pure MBBS and related stuff. You can do the clinical research, you can with the help of ICMR, and you can do MBA. The MBAs are of, again, healthcare management, medical management, hospital administration, bioinformatics. There are various types of MBAs which are related to health sector. And you can even do law and can become a medical legal advisor, considering the increasing number of lawsuits. And you can do the health informatics and data sciences, which is going to again play a crucial role. And then there are huge shortage of medical writers, and you can be part of medical journalism. And you can even do MTech after your MBBS in the biomedical engineering, and IITs are offering this. You can enter into IITs by doing MTech, by opting for MTech biomedical engineering, and you can again be an entrepreneur with coming up with a medical or healthcare entrepreneurship. These are new horizons like clinical research, MBA, various types of MBAs, medical legal advisor, and health informatics, medical journalism, MTech, biomedical engineering, and entrepreneurship. And if you see the surprising data, the number of doctors who are applying for the business schools, this is from Indian School of Business. If you see, can you read it? The number of medical doctors in the flagship MBA program have gone up to 11 this year from 6, which is the previous year. From IIM Kolkata, if you see every batch, there are 2 to 3 doctors, and IIM Lucknow, it has approximately 8 to 9 doctors, and for executive MBA programs, the number even in IIM, basically what happening is on an average 1 to 2% of the batch is having the doctors. This has been a recent trend. This is all about the NEET, next PG, INSET examinations, and various options in addition to the core MBBS. I just want to concise with the employment with MBBS, the defense services, UPSCs, corporate hospitals, establishing own clinics, PHCs, industrial medical officers, and new horizons being clinical research, MBA, medical legal advisors, health informatics, medical journalism, entrepreneurship, and MTech biomedical engineering. So if you have the dream of entering into IITs or IIMs, yes, still you do have options, and the competition is relatively less when compared with the NEET PG. You can still give a try if you really want to do something different. Then coming to what are the abroad options. If you are looking for the abroad options, for USA, again, the entry is through USMLE. If you want to go to Canada, it is by MCCQE and NAC-OSCE examinations. And if it is for UK, you can go either through PLAB or through membership examinations like MRCP, MRCS, MRCPCH, COG, all these things. And for Australia, it is AMC CAT and AMC Clinical Australian Medical Council Computer Assessment Test and Clinical Examination. And if this is a rate of 30%, international medical graduates constitute about 30% of the physicians either in USA, United Kingdom, Canada, or Australia. And now let's take one country at a time and we'll discuss. And as you said, for entry into UK, there are two ways. One is through licensing examination, that is professional and linguistic assessments called PLAB examination, and another through membership examinations like MRCP, MRCS, MRCOG, MRCPCH is for pediatric and child health, MRCM for emergency medicine, MRCGP is for general practitioners, MRC Psych is for psychiatry, FRCA is fellow of Royal College of Anesthesia, FRCR is fellow of Royal College of Clinical Radiology, all these things. And coming to PLAB, it's Professional and Linguistic Assessment Board examination, and remember, it is a licensing examination. It is a licensing examination, and it is conducted by the General Medical Council. And PLAB 1 has questions related to the current best practice in the UK, and which is equipment which is routinely available in the UK hospitals. And PLAB 2 is based on everything a UK trained doctor might expect to see on the first day of the foundation year. That is called FY2. Your internship is equivalent to FY1 there, and the next level is called foundation year 2. The internship which you do in India is equal to foundation year 1 there. Okay, and the exam format, the PLAB 1 is a multiple choice question examinations with a single best answer, which has 180 questions in a 3-hour span. And PLAB 2 is a OSCE examination, objective structured clinical examination. It has 18 stations with 16 scenarios will be there, each lasting 8 minutes, and 2 rest stations where you can take the rest in between. And it reflects the real life settings, including a mock consultation or acute ward, like for example, like history taking, diagnosing, all this. And I'll explain when we discuss about the AMC. Yeah, it mentioned clinical examination, practical skills, and deals with the interpersonal skills. This is the basic examination format. And then the upcoming, how many times the PLAB examination happens? Usually in UK, it used to happen 4 times a year, and in overseas, it used to happen twice. But from 2020, because of COVID and the long wait list, they again increase it to 4 from 2021 onwards. Even in India, the exam is happening 4 times a year. And examination centers, yes, you can write PLAB 1 in India, Bangalore, Chennai, Hyderabad, Kolkata, Mumbai, and New Delhi are the centers. And examination centers for PLAB 2, you have to write only in Manchester. The PLAB 2 examination happens only in the GMC Clinical Assessment Center of Manchester. This is about PLAB. And if you see the PLAB pass rate, it is approximately around 60 to 70%, 65 to 70%. If you see, it is around even PLAB 2 pass rate almost remains the same, 66. So every 2 guys out of 3 people who attempt to clear the examination. And if you see the increasing trend of number of people who are sitting for PLAB 1, starting from 3,100, 3,300 to 11,000 and 10,000, there's been significant increase year on year. And the number of students who are aspiring for abroad careers increasing, and so is the increase in the number of people who are attempting the PLAB examination. And what is the fees for the PLAB 1 examination? It is approximately 25,000 for PLAB 1, and approximately comes to 95,000 for your PLAB 2 examination. And then come to MRCP. And please understand the basic difference. PLAB is a licensing examination, and once you clear this examination, you will be starting at the level of foundation year 2. Okay, and coming to the MRCP examination, it is a member of Royal College of Physicians. It's a membership examination, and it has 3 steps: Part 1, Part 2, and PACES. This is Part 1. Part 1 and Part 2, if you see, the syllabus almost remains the same, except 25 questions from basic sciences here in Part 1, basic clinical sciences, and which won't be there in the Part 2. Predominantly, Part 1 deals with the knowledge part, and Part 2 deals with the application of that knowledge. That's the fundamental difference between MRCP Part 1 and Part 2. Both the examinations has 200 questions in 2-paper format. Morning, there will be 3 hours of paper, and afternoon will be 3 hours of paper. So if you are attempting MRCP Part 1, in the morning, you'll be attempting 100 questions for in the 3-hour examination. In the afternoon, again, in 100 questions for 3 hours. So cumulatively, you'll be sitting for examination for 6 hours for Part 1 and 6 hours for Part 2. Then coming to the examination. Previously, the exam used to happen till last year. The exam used to happen 3 times a year. Now they increased it to 4 times a year because of the long wait list because of COVID. 4 times a year. And yes, you have centers. You have centers again in Bangalore, Chennai, Hyderabad, Kochi, Kolkata, and New Delhi. And how does the spaces? PACES is the third step of MRCP, and there's been slight change with the PACES 20, which has been postponed PACES 2021 carousel. Again, the stations remain the same. The components which will be tested, you'll be assessed for one respiratory case, one abdomen case, one cardiovascular case, one neurological case, and one station where you will be assessing history of a patient, and one how to communicate, and then there will be two brief clinical consultation scenarios. This is how the PACES exam will be conducted, and this is over 2 hours 5 minutes examination. Each carousel will be having 20 minutes with gap of 5 minutes break in between. This is the MRCP examination. So who can attempt for PLAB and who can attempt for MRCP? You can attempt your PLAB 1 examination even in your internship after clearing your OET or IELTS examination. I'll explain about that. But to attempt your MRCP examination, you have to have 1 year of MBBS, post MBBS experience. That is, like if you complete your internship in 2021 of March, you can apply for MRCP Part 1 examination after doing 1 year of clinical work after your internship. So that is mandatory. And another major difference, PLAB is a licensing examination, MRCP is a qualification examination. And after completing all the 3 steps, you can register this MRCP as an additional qualification with the National Medical Council of India. MRCP is recognized in India as a additional degree or postgraduate degree. And all these exams, you can, all the MRCP Part 1, Part 2, and PACES, you can attempt very well in India itself. We have centers in Bangalore, Chennai, even Hyderabad, Kochi, Kolkata, and New Delhi. This is about the MRCP. Then coming to the other examinations, MRCP, it has, as I said, like it has 3 steps. MRCS 2 steps. MRCOG, gynecology, it has 3 steps. MRCPCH 3, MRC Psych, there are 4 steps, and MRCM 3 steps. Fellow of Royal College of Anesthesia 4, FRCR 3. The only thing is here for all these examinations, except MRCS, you can Part A, you can attempt even during your internship, but for rest all the things, even MRCOG, MRCS and MRCOG, you can attempt your Part 1. For MRCOG, you have to get the eligibility certificate or the expression of interest certificate, and then you can attempt your Part 1 during your internship. But for the rest of the steps, again, you have to have clinical working experience. Leaving these things, for the rest of the things, let it be MRCP, to apply for your Part 1, you need to have 1 year clinical working experience. And for PACES, you need to have 2 years of clinical working experience by the time you attempt your MRCP examination. And you want to conduct, clear MRCP, CH or Psych or CM, you have to undergo a structured training program. Only then you are eligible to appear for those examinations. Because once you clear these examinations, they are going to award you a degree which is equivalent to a postgraduate qualification. So you have to confidently treat the patients. And coming to the MRCP examinations, all the 3 steps, there are, the leaders of the country is like Oslo's Academy, who does the coaching for MRCP clinical primer program. And if you see this MRCS programs, again, it can be with the post MBBS. And remember, with post MBBS, you can attempt MRCP and MRCS. There is no need, and there will be many students who might be under the impression we have to complete our post graduation to attempt MRCP or MRCS. No, after completing your MBBS, you can attempt MRCP or MRCS. If you are really looking for an abroad career, yes, this is an option for you. Rather than keep on preparing for NEET, you can explore the options of MRCP, MRCS, and the other options. And then coming to IELTS or OET examination, the English examination is mandatory whether you want to go to US, UK, or Australia. When compared with IELTS, nowadays 95% of the doctors, 95 to 19% are preferring OET, which is occupational English training. This is related to healthcare, which has 12 versions of healthcare fields like doctors, nurses, and all. And here again, the same components: listening, reading, writing, and speaking will be there. You need to get at least grade B to clear this. And the exam happens every fortnightly, which you can take it from. It happens in all metro cities where you can go and attempt the examination. This is all about the UK examinations. Very broadly, I'm touching it up. And then coming to USMLE, United States Medical Licensing Examination. It has previously used to have USMLE step 1, step 2 CK, step 2 CS, and step 3. Step 1 assess whether a student can understand and apply important concepts of the basic sciences to the practice of medicine. Step 2 CK, clinical knowledge, it assesses the ability of the medical knowledge and skills for the provision of the patient under supervision, that you can efficiently manage a patient under the supervisor care of a consultant. So, and step 2 CS has been discontinued now from 2020. And step 3, it assesses the same. It also assesses the ability to apply medical knowledge and skills for the provision of patient care. But here, even without supervision and with emphasis on the patient management of patient in ambulatory settings. Step 1 and step 2, you have to clear before applying for your residency applications. And step 3, it's optional. You can complete before, and yeah, you can complete during your residency there in US. And if you see what are the predominant changes which came for this year, the changes include changing step 1 score, reporting from a 3-digit numeric score to reporting only pass or fail. This is one major change, step 1. And reducing the allowable number of exam attempts on each step from 6 to 4. Previously, USMLE steps, you can attempt 6 times, and now it is decreased to 4. And step 2 clinical skills they announced the discontinuation of step 2 clinical skills. So now things become easier. Earlier, like you have to travel to US to attempt the step 2 clinical skills, but there's no need now. You can attempt the step 1 and step 2 sitting in India, and you can apply for your match. And it's been very clearly mentioned, those who are applying for the examination after January 26th of 2022, which is 3 months from now, there'll be only pass or fail. Like this, there won't be any score. You will be just given just the pass or fail for step 1 examination. But for step 2 examination, step 2 CK, you'll still get the score, 3-digit score. And as I clearly mentioned, the number of steps has been decreased to, the maximum number of attempts is limited to 4 from previously, which was 6, from 6 to 4, and this is effective from July 1st of 2021. And scores earlier, even now the pass mark is 194, and for step 2 CK it is 209, and for step 3 198. And if you see the trends of how many candidates who are applying and how many percentage used to clear, is approximately 83% of the candidates pass. This is for step 1, and this is for step 2 CK. Almost the similar. This is of last year 2019, and 2018 it's again the same, 78% and 82%. It remains the same. And average number of people who are attempting the step 1 is approximately 16,000 every year. And if you see what are the subjects which are of predominantly importance in step 1 examination, you see pathology carries approximately 44 to 50% of the weightage, followed by physiology 25 to 35%, and pharmacology 15 to 22, and that's so even genetics and behavioral sciences. And step 1 is a one-day examination. It is divided into 7 60-minute blocks, which will be administered in 1 8-hour testing session a day. And the number of questions per block in a given examination vary, but they won't exceed usually more than 40. And the total number of questions for all the blocks combinedly in a day won't exceed more than 280. This is about the step 1 examination. Then coming to step 2 examination, it's also one-day examination, but here instead of 7 60-minute blocks, here you will be having 8 60-minute blocks and administered in a 9-hour testing session. And again, the number of questions won't exceed 318. And another change in step 2 CK examination is the importance for foundational basic sciences. Usually basic science concepts were tested in part 1 step 1 examination, but again the knowledge related to that is now the questions are also being asked in step 2 CK. Related to the, if you see clearly regarding the diagnosis and management, earlier those who attempt the examination before November 2020, the questions related to diagnosing a scenario is more than the management, but they mentioned here equal amounts of both types of test items of diagnosis and management types from those who are attempting the examination after November 2020. And again, 2 to 4% of the questions are related to the general principles of foundational science. That is very important. And step 2 CK, 50 to 60% of the questions are from general medicine, internal medicine, 25 to 30% of the questions are from surgery, 20 to 25% from pediatrics, 10 to 20% of the questions from obstetrics and gynecology, and 10 to 15% of the questions from psychiatry. This is the subject-wise distribution. And what are the requirements to apply for USMLE? You have to either, you might be a graduate or you might be studying in a college which is listed in the World Directory of Medical Schools, as that is the eligibility for ECFMG eligibility requirements. And retake, you may take the same examination no more than 3 times in a 12-month period, and attempts, as we mentioned, the 4 times is the maximum limit. And you can, yes, you can take the examinations very well in India itself. We have centers in Chennai, Hyderabad, Ahmedabad, Bangalore, Kolkata, Allahabad, Mumbai, and New Delhi. The students and graduates, for Indians, we have to apply through ECFMG website, and during the application process, select an eligibility period, and the scheduling permit time you have to select, and then after visiting the Prometric website, book an examination slot. And what are the cost for the applications? The application for ECFMG certification, it costs you $150, and step 1 and step 2 CK approximately $975 US, which is approximately coming up 75,000 step 1 and step 2 CK. This is the examination cost. So coming in a clockwise direction, what is USMLE? First master the USMLE steps, step 1 and step 2 CK. Then apply for ECFMG certification, register through ECFMG, verify your medical degree, confirm you passed your step 1 and step 2 CK, and receive the ECFMG certification. Then apply for the residency. During the, when you are applying for residency, get proper letter of recommendations, prepare a perfect personal statement, decide which specialty and programs you want to apply, and submit your application through ERAS, Electronic Residency Application System. And then you enter the match, that is National Residency Matching Program. This is the USMLE format. And then this is in brief about the USMLE pathway. Then coming to AMC, Australian Medical Council. It is slightly confusing, but take one point at a time. For international graduates, they can enter through various pathways: competent authority pathway, standard pathway, specialty pathway. But for you to remember, as an MBBS graduate, it is either through standard pathway or competent authority pathway. And there are various types of registration: general registration, specialist registration, provisional, limited registration. For us, the importance is general registration, which is a full-fledged registration where you can practice as an MBBS graduate. And I'll explain when you'll get a provisional and limited registration. And we'll discuss about 2 pathways, which is the competent authority pathway and standard pathway. The standard pathway is any Indian graduate, you just completed your MBBS, and what you do, apply to the AMC, Australian Medical Council, for the standard pathway and primary source verification. You have to apply, and you have to verify whether your college is registered with the World Directory of Medical Schools, and through EPIC verification. Once it is done, you apply for the AMC multiple choice questions examinations, or also called an AMC CAT examination. And once you clear this examination, say this, pass the AMC, and then you apply for the step 2. Pass the AMC clinical exam and receive the AMC certificate. And once you apply for the jobs, and once you secure an employment offer, apply to the Medical Board of MBA for provisional registration. After clearing your AMC CAT and AMC clinical, both the steps, and getting a job won't guarantee you, or they won't give you a general registration. They'll give you a provisional registration, and you enter there, complete 12 months of supervised practice. That is at least 47 weeks you have to have a supervised practice, and then you apply to the Medical Board of Australia for general registration. This is one pathway, standard pathway. The another way of entering into Australia, another mode through standard pathway is you give the step 1 examination, the AMC CAT examination, and once you clear that, apply for the jobs and secure an employment offer. Once you do that and apply to the Medical Board of Australia for limited registration, because you didn't clear completely the second step, you apply for the limited registration. And once you apply for the limited registration, again complete 12 months of supervised practice. That is approximately 47 weeks you have to do that. During that time, again, you have 2 options. While you are studying there, you have 2 options. One, either again go back, pass the AMC clinical examination during this 12 months and receive the AMC certificate and go for general registration. Or there is something called complete workplace-based assessment and receive AMC certificate. Rather than giving the AMC clinical examination, it's just like a practical examination which is being conducted by your own internal examiners in your college. They'll be assessing complete workplace-based assessment and receive the AMC certificate. By doing this, you will get the general registration. I'll explain this once again. Through standard pathway, first you have to verify your medical college from World Directory of Medical Schools through EPIC, and then pass AMC multiple choice question examination. And then 2 options. If you get an employment offer, enter with a limited registration, complete 12 months of clinical practice. While you are doing 12 months of clinical practice, you can clear AMC clinical and get general registration, or you can get complete workplace-based assessment and receive the AMC certificate. The another way, complete AMC CAT and AMC clinical, secure an employment letter, apply for provisional registration and supervisor practice, and then you get to the general registration. This is the standard pathway. And what is a competent authority pathway? So what exactly competent authority pathway means? There are few examinations. Suppose you might have prepared for PLAB or you cleared your USMLE, and let it be for Canada. For those who cleared those examinations, they consider, Australia considers either through PLAB, USMLE, Canada, those who cleared those examinations as competent. This is called as competent authority pathway. But just clearing the examinations is not sufficient. If you see, after completing PLAB, you have to at least have 12 months of working experience in UK, 12 months of supervisory training in UK. Then you can directly enter into Australia. I'll explain about that. And similarly, if you had done USMLE, successful completion of medical licensing step 1, step 2, and step 3, and completion of minimum 2 years of graduate medical education of residency program, then you can enter. This is called competent authority pathway. That means after completing, suppose for example, you have completed your MBBS from India, and then you cleared your PLAB and worked there for 1 year, rather than again writing your AMC CAT and clinical examination, you can directly step into Australia. Okay, see here, IMG of, once you suppose you completed your PLAB examination, just for example, you completed from Usmania Medical College, and then you cleared PLAB, and then you are presently in Manchester, and then you got a job offer, you applied for the jobs and you got it from Australia. So what you do is, once you get an employment offer, you apply to the Australian Medical Council for again primary source verification of primary qualification, and undertakes a self-assessment against the eligibility criteria for competent authority pathway, whether you have completed you have to submit the proofs that you have completed the PLAB and you have 1 year of clinical working experience, all these things. And for Medical Board of Australia, you apply for the specified positions and you have to give an interview, pre-employment structured clinical interview will be there. And once the board confirms the eligibility via competent authority pathway, they'll give you again the provisional registration. And with this provisional registration, you have to work again for 12 months. That is 47 weeks approximately, and then after they get the oriented report and work performance report, you will be given the general registration. And from there on, you can progress into the post-graduation and all. This is at least the first steps to enter into the Australia. Okay, this is. Then coming to MCQ examination is called as Computer Adaptive Test AMC CAT. It's a 3.5 hour session examination which has 150 questions where one correct response, one single best answer you have to pick up from 5, and you are expected to complete all the 150 questions. And again, the questions, 30% of the questions from medicine, 20 from surgery, 12.5% from OG, and 12.5 from pediatrics, psychiatry 12.5, and population health, that is community health, it is 12.5. And exam happens every month. Every month the exam happens, usually in the middle of every month, and stations are 16 and 4, and they'll be based on pass or fail for every station, and there is no limit to the number of attempts the candidate can attempt for the clinical examination. And for example, even in the PLAB or for AMC in the clinical examination, PLAB 2 or AMC clinical, they'll be broadly assessed. For example, history taking, examination, there'll be diagnostic formulations, management, counseling, and education. For example, taking the history of a patient with symptoms of shortness of breath, or taking a history from third party such as a parent or carer of a parent, or interpretation of a laboratory report, diagnosis of a skin lesion, or presenting management plan for a patient presentation. All these things which you have been doing day in and day out during your internship, you have to present in a very structured format. This is not something which is, you might have taken hundreds of times the shortness of a patient presented with dyspnea, you might have taken history, but taking a history in a sequential format is very important to get this. And then the examination fees, assessment pathway examination fees, Australian dollars. To establish AMC portfolio, it is approximately 500 Australian dollars. And AMC CAT, it costs you 2,720 Australian dollars, that is approximately 1.5 lakhs. And AMC clinical examination is 3,530, close to 2 lakhs is your examination fees for Australian CAT part 1 and part 2. And how to establish an AMC portfolio? It's just simple. The first step, you have to submit your medical degree for Epic, and you have to get it verified through Epic, and you create an AMC account and assess your application, and then you apply. Once the application is complete, you going through which pathway, the standard pathway or competent authority pathway. Specialist pathway is something who completed their post graduation and want to enter this. Okay, and there is something called short-term training with an Australian medical college or like area of need that is different. That for you, the important is standard pathway and competent authority pathway, which I explained to you already. Then the most important thing, and which is grossly underestimated, and why majority of the Indian medical graduates do face when they want to enter into the when they want to enter abroad, is they won't build a proper portfolio, which is very, 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 very crucial. What is meant by proper portfolio? I'll just, this is a snapshot from a portfolio which, if someone wants to apply for internal medicine residency in UK, that is through for the core medical or internal IMT programs, this is a template of how you will be assessed for a portfolio. What are additional undergraduate degrees and qualifications you have, any additional postgraduate degrees and qualifications, and additional achievements like prizes, honors, any presentation, research paper presentations, posters, publications, teaching experience, training in teaching, quality improvement, leadership and management, how committed you are to that specialty, and what are the achievements outside medicine, how the training courses you attended. For everything, you may have mentioned that, and whether the evidence is present or not. So most important, you might have done something, you let it be even a small thing you organized in your college, try to get it documented. This is going to be, these small things are going to matter a lot, and you will be assessed on based on, there will be point systems where you will be graded for everything, and between your competitor and you will be given the positions or residencies based on these things. The reason the majority of the students ask this question, why Indian medical graduates is difficult to get into surgical specialties, the same reason. If you see this, for you to build a proper portfolio, we have to concentrate on audits and quality improvement. I'll explain everything in detail. The publications, the presentations, you have to have proper leadership and management roles, the training you received to teach medical professionals. It's not you teaching, it's the training which you receive to teach the medical professionals, let it be your colleagues or let it be the nursing or physiotherapists, how you can teach, and the experience in teaching medical professionals, and additional degrees, any postgraduate qualification examinations, how committed you are to the specialty, and achievements outside medicine. In addition to these things, if you are applying for the surgical specialties, for all your clinical activity, you have to maintain a proper logbook, the reports by your trainer, and regular audits, written workplace assessments, and list of competencies signed by your supervising consultant, and other assessments, all these things. But we won't care much about these things. That's the reason why we face trouble while you are applying for the surgical residencies. And what is meant by audit and quality improvement? There's a little bit of difference between audit and research. See, research is about finding answers to the questions which produce the new knowledge. But audits and quality improvements is how you can improve a healthcare service, like proper hand washing, how many times you have been doing it, and whether it's been regularly being done or not. And let it be how many CLABSI, central line associated bloodstream infections are there in ICU, how many VAP cases are there. So assessing and how best you can improve. All this is basically the audits. And doesn't matter, the audit or the quality improvement project does not need to be in the same specialty you are applying. Suppose you are applying for the medicine, you can do it for pediatrics. The most important is the project was done correctly and it resulted in a positive change. It has to be documented. This is very, very, very important. And then publications. This is another most important thing. It's not just the publication, the type of publication, whether it's original research, case reports, or editorial. And what is your position? Your position as the first author, as the second author, co-author, or corresponding author, many things. And whether the journal is peer-reviewed, or it's indexed in PubMed, or it is a predator journal which you pay by getting, all these things matter. And how many publications you have also matter a lot. Publications again plays a crucial role. And presentations, like in OSMICON, suppose any conference you are presenting, whether you are presenting where it's oral or poster, and nowadays there's not much difference between oral or poster, and how many presentations you have, and what is the level of meeting, whether you're presenting in your own college conference, or whether you're presenting in a statewide conference, or presenting a national level conference or a regional level conference, these things matter. And what is the type of presentation? Again, it's original research, or it's a case report, or it's an audit, or you are presenting a meta-analysis. All these things in the ladder, meta-analysis carries a crucial role. So all these things are very important. And then coming to the leadership and management, it might be the leadership roles might be medical and non-medical positions, and how much duration you are in that tenure, and what is the evidence that you have made difference as a leader. You might say, like, I worked in so and so place for this many years, but what is the difference you made during your tenure? It can be as simple as your class representative. Many of you like might be class representatives, but there's no evidence, so you have to get the certificates for that class representative. You might be managing the rota in your specialty or in your ward. You might have efficiently handle your batchmates and do that. Even that matters. And let it be, you are an ambassador, let it be for any national conference or international conference or state conference, you make the ambassadors, even that helps you. And organizing capabilities, how efficiently you can organize the things, let it be conferences, let it be your college fests, everything. And you have worked in any voluntary organizations, what is your role, and how you made a difference, and getting them all documented is very, very, very important. All these things, at least one of you, I mean, every one of you might have done something or other, but the main reason why we lag is we don't document and we don't keep the things in our hand ready. And then coming to teaching, here you have to, there's something called training you have received to teach the medical professionals. You can't teach just like that. What is the training you have attained to teach the medical professionals the courses, and what are the experience you have in teaching the medical professionals? How often you teach? What is the duration of the teaching program, whether it's an organized teaching program or not. See, this might be for your fellow doctors or your juniors, or it might be for your nursing colleges or physiotherapists, whoever it might be, medical specialties, whether you are interested in teaching, that matters a lot, because in UK, US, once you enter from junior grade to middle grade, you start teaching your juniors. That is very, very important. Teaching is a part of the curriculum. I mean, teaching is a part of your program. Then coming to additional degrees do matter, whether it be intercalated bachelor's degrees, postgraduate certificates, diplomas, any research-based MDs or any PhDs, obviously they do help. And what do you mean by commitment to specialty? When I say commitment to specialty, when I say commitment to specialty, if you are interested in general medicine, you have to make sure. Just a second, there's been some disturbance. Okay, when I say commitment to specialty, suppose you are interested in surgery. When you are interested in surgery, how many electives you have done as a medical student in surgery? How many clinical attachments extra you have done? What are the taster weeks? That is like taster weeks. Excuse me, Dr. Bashir, can you just mute, please? Yeah, when I mentioned commitment to specialty, suppose you are interested in surgery or orthopedics or pediatrics, whatever it might be, how many electives you have done as a medical student, what are the clinical attachments you have done, what are the taster weeks, and essentially the clinical attachments which last only for 1 week, to see like how you feel in that while working in that particular department, and attendance at relevant courses and conferences related to, suppose you are interested in surgery, how many conferences and undergraduate you attended but related to that specialty or related to that conference, that surgical specialties, and logbook of all relevant procedures. Suppose you are interested for surgery, what all things you have done during your final year, during your internship, and after that, maintaining a logbook, and publications, audits, and presentations which are related to that specialty, and you have done any relevant exams or qualifications related to that. That is meant by commitment to specialty. It shows that you are very planned and you are predetermined to enter into that specialty, and it is not just a matter of choice. Basically, what happens for us is we give examination we need, and based upon our rank, we select that. But if you are really very focused to enter into any specialty, and suppose you want to enter into neurology, you have to start working from now, like start attending something related to the neurology postings and try documenting something, getting letter of recommendations from those the neurologists, and attending conferences in neurology. All these things you should start doing from your final part 1 of MBBS. That is meant by commitment to specialty. And again, what are the achievements outside medicine also do matter, like what achievements you have in sports, arts, any charity or voluntary work you do, any technological innovations or any patents you have. All these things do matter, and all these things has to be maintained. And each and every component which I mentioned till now has a significance, and the points, point-based scoring will be there in your portfolio building. So to build an effective portfolio, you have to concentrate on all these things. I repeat, audit and quality improvement, publications, presentations, leadership, management skills, training, teaching, additional degrees, postgraduate qualifications, commitment to specialty, and achievements outside of medicine. Okay, and that's all about, we discussed about the NEET, next PG and INSET examinations and the patterns and how best you can prepare and what are the other options available to us after MBBS and abroad with PLAB, USMLE, and membership examinations like MRCP and MRCS, MRCOG, and Australian Medical Council examinations. And we discussed about what is the importance of portfolio building and how you can build it effectively. And now, as it's already we've overshooted the time, for all your questions, see, you will be getting a link where you can fill up the basic data and you can ask as many questions you want. You can ask just one question. For the first question, we kept this mandatory, and for the rest of the questions, you can add as many questions. And all these questions will be answered subsequently during your asynchronous time. And we will mention the question and we'll be answering for each and every question. Okay. And all the very best, guys. And we wish you all the very best for all in your college days, career, and all in your future endeavors. All the very best from vSynapse. Basically, through vSynapse, we believe that every student is unique and every journey is unique. So the solution also has to be unique. And to bring it's a one-stop solution for all the medical education needs, starting from their English examination till their helping them in training and portfolio building, let it whatever it might be, and mentorship. Mentorship is one most important thing which is undermined, and we have a biggest pool of 2,488 mentors from all over the world. Suppose you are targeting for USMLE, a mentor from USMLE will be you who crack USMLE and been there will be helping you. And similarly, if you are trying for MRCP, a mentor from who cleared MRCP will be mentoring you. And if you have any doubts, even the NEET, next INSET, the mentorship regarding that, you're free to ask the questions, and all yours, every single question of yours will be answered in a very detailed fashion. I hope this session is very useful for you, and all the very best. And again, wish the team Osmicon the very best, and keep continuing the Osmicon for the years to come. And we wish you all the very best. And once again, thanks for inviting, and hearty congratulations for all of you for attending the session and taking that one extra little step in attending the research conference and building your portfolio. All the very best, guys. Good night. And the link for the questions will be sent to you by message, and you can send the questions till tomorrow morning, and every single question of yours will be answered. Thank you, team Osmicon.
It's an absolute honor to have you, sir. Thank you so much for clearing our doubts. Thank you, sir.
Yeah, thank you, Doctor. And once again, all the very best and good night, guys. Thank you. Thanks, team Osmicon, for giving the opportunity.
Thank you, sir.